Hello and welcome to What Would Larry Do? I am Dr. Ann and I'm here with Larry Hellwig.
Hello, hello.
It's a Tuesday afternoon right after Memorial Day, so we are struggling to stay alive after a long weekend.
A long weekend of vacation and relaxation, and I'm exhausted. I can't do that anymore.
I know. But we have a fun and exciting podcast for you guys today. We have a guest joining us here in studio, so we are welcoming Katie Cutler. She's been in the industry for almost 17 years as a licensed esthetician and certified laser technician, but she has been with Aerolase, which is a laser company that has been out there, and she is their master clinical trainer at Aerolase, and she's been with them for the last 10 years. So welcome, Katie.
Hi, how are you? And everybody, thanks for having me here today. So excited to be here and get to talk about our amazing devices. And we're so excited about Clearskin, bringing them on and being part of the school.
Yeah. Well, good. Well, Larry, tell us a little bit about what's happened with Aerolase with us in the last month or two.
Well, I was at a trade show, and the last trade show we were at that we can remember.
In Vegas at some point.
That's Vegas. That's Vegas talk. We were at the trade show and going around to the booths, and I found a gentleman there that I've known for a long time named David Bays. And, you're in the industry for 20-some years, you get to know just about everyone.
This is true.
He started telling me about his product and couldn't believe we didn't have it, and kind of the who's who in dermatology have it. So I went back and started thinking about it, investigating it a little bit, and then sure enough, within a couple months after that, the sales rep showed up leaving a brochure and wanted to see me, and of course the staff said no. Do such a good job policing, and but left a good packet brochure, and the next day we called him and had him come in, and it's interesting because when you look at technology, especially if you've done this for a long period of time, you do have to do your due diligence.
Mm-hmm.
And I was concerned because we have a lot of technology, and do we really need more? And what does this do that ours doesn't do? And there's always going to be overlap. You're going to have overlap no matter what. And I think some technology works better on some patients than other technology. And but what was so interesting is, as a training facility, we would like to make sure that we can treat everyone and teach everyone on all skin types. And I guess that's what came to the forefront is we've had more and more students come in that are skin type 5 and 6, and we do treatments as part of the training on them. Students treat each other. And we really didn't have an acceptable way of being able to do that with our current technology. So that was the beginning. Okay, that would solve that, but it would also solve us referring our patients out that are skin type 5s and 6s. And why not treat them if we have technology that, these dermatologists, well-known dermatologists, are saying it's, some of the best technology you can get. So anyway, that's what led to it. And conversations and things back and forth, and here we are, and we now have it.
Well, and it's funny too, because that initial meeting that we had with them in our office where they actually came back in, a couple of things that I think about from that is, number one, the fact that we're in Arizona with a lot of sun exposure. And that can be very detrimental to laser procedures. And number two, I remember they got done with their whole presentation. And they're like, can you see any of these products fitting into your practice? And I just slowly raised my hand. I was like, I have one. I could see Larry's face. He's like, oh no. And I was like, I need to know more about this one right here. Just going through some of the things about it, and we'll kind of get into that. Because for me, and I guess we'll kind of just jump into that. The first one was the Neo Elite.
Yes.
As they were presenting like their whole platform of everything that they had and what they could do and this and that. The first one I went to, I was like, this one right here. And there was X, Y, and Z of why I wanted it, which I'll talk about. But that was the first one is when they asked that question and I had to like slowly raise my hand, I was like, sorry, Larry, I'm going to give in to this. This is the one that I want. So let's just start off by jumping in and talking about the Neo Elite and what it is and what we can do with that beautiful laser.
Absolutely. It is a beautiful laser. Aerolase has been really around for about 10 years or more for a while, but we really started getting a lot of exposure in about 2018. And some of the struggle with, I feel like, getting us to take off was because our device is small and it looks like, well, it doesn't look like all these other lasers. Well, that is because we have an air cooling system where most lasers are cooled with a water system. So it causes the device to be very bulky and big, where our laser is nice, compact, and small. So that's one really great advantage to the device.
I'm guilty. Because when I saw it at the trade show,
You were like,
I thought,
no way, this
"There's
can't
no way
do
this,
it."
There's no way this is going to do what we need to do at our office. This is for a spa, not a med spa. There's like a little spa unit. And that was my mentality going in, and I had to learn different.
Yeah, that's like
and
him
that's
looking
the
at
crazy
car
part.
engines.
Yeah.
It is. I feel like it gets that you have to get past that with some, people for them to understand. But when someone's knowledgeable, like you guys are very knowledgeable, you understand technology, you really know, how things work. And in the industry, I feel like a lot of times people just don't know, so they think that it's what it looks like or what they're told, or the name of it's popular because it was on TikTok or Instagram or whatever. But really, it's about the technology and how the technology works. And our technology is amazing. It really is. We are different than a typical YAG 1064 device. We have a short pulse as compared to a long pulse.
Yeah.
And just
So
like to
let's
simplify that.
I was going to say, let's go into that for a minute, because just starting out, this is a 1064 nanometer, but it's a short pulse versus a long pulse, because most of us are used to that long pulse.
Yes, we are the only short pulse, 650 second microsecond pulse.
Okay.
So
Microsecond versus milliseconds, because we're used to it in milliseconds.
yeah, so the difference is, I'm just going to simplify it for someone
Perfect.
who doesn't understand
Go for
short
it.
pulse and long pulse. If you think about it, head going into the skin. So a short pulse goes in and out of the skin very rapidly.
Yeah.
And it gets to the target, and the target is what the laser is looking for, absorbs the energy from the laser, and then comes back out very quickly. With a long pulse, it's doing the same objective, going after the target, but it stays there a little bit longer. And when I say longer, we're still talking about, a very short amount of time. Milliseconds. But that time, staying there a little longer allows for possibilities of thermal damage in the surrounding tissue.
Okay.
So therefore, we could have some hyperpigmentation, possibly hypopigmentation, because that heat's staying there longer than it needs to do what we are trying to get it to do. Okay, so for example, if we're working on hyperpigmentation on someone's skin, and a long pulse, device goes into the skin and comes out, it might not be able to be effective on a 4, 5, or 6.
Okay.
Because there's too much competing chromophore.
Yep. And you're talking about Fitzpatrick skin types 4,
Yes,
5,
I'm
and
sorry.
6.
Yes.
Nope, that's okay.
I have to be more thorough. So because there's so much competing chromophore of melanin in the skin that we could, actually make it worse.
Yeah.
Where with the short pulse, we're able to get into the skin, and the energy can be absorbed by the melanin and come right back out without affecting that surrounding tissue, and allowing these darker skin types of 4, 5, and 6 to be able to be treated with a device that for a really long time, it wasn't a possibility. People of a darker skin type were unable to get certain laser treatments because of the fact that the residual damage it could cause to their skin, which so you're going to get one thing fixed, but then another thing could possibly happen. So what, really would be the point?
Well, and I want to show a couple of photos before we jump off, because these are some of the things that caught my eye when we were looking at this. Is we've got a couple of photos. One is some PIH from a chemical burn, and another one is PIH from an IPL burn. that were then fixed by using the Neo. And this is something that is super impressive to me. So
It's very impressive. And being said, I have seen myself
So this is
much
PIH.
damage from IPL
Yeah.
on darker skin types.
yes.
And
Oh,
chemical peels because technically they're not supposed to be used on a 4 through 6
yeah.
skin
This
type.
is the one that was killing me right here. So
Oh,
this,
yes.
this dark skin type that somebody used an IPL on, I
Terrible.
mean, that should have just been a red flag in the beginning. But look at how they're able to clean up the damage. And when I'm saying PIH, I mean post-inflammatory hyperpigmentation following from an intense pulse light burn on this skin type. That is something that is extremely hard to fix.
It is.
I mean,
It's
this
amazing.
is something that, you know, back in the day when it would happen, we would be like, you're screwed.
You're
Like,
screwed, yeah.
we're going to be fighting this forever. We're going to do all kinds of topicals. I mean, this, when I saw some of these and I had to raise my hand in that little meeting, I was like, I have questions.
And it
I was like,
truly
this is
the
something
solution.
that was, yes.
For a darker skin type. Not only for cleaning up damage,
Yes.
but for giving a darker skin type the opportunity to do these treatments that they were not able to do in the past. And we would have to find other modalities and other things to get them where we wanted to get them.
Yes.
But now that's not the case with Aerolase.
Yeah.
With Aerolase, you can use it on all skin types very, very safely under the right settings and proper protocols. It is very effective. We are so excited about that just giving those people the chance to
Yeah.
really improve their skin on a level that is aggressive and not just by doing it with, less aggressive treatments.
Yeah.
Well, one of the things we teach is that you're not teaching just the skin type based on hair color and eye color, but targets. So how much sun, how much they have. And in Arizona, of course, how do you
a lot
not
of
get sun? You
yep.
get 300 plus days of sun, and so tanned skin is an issue.
Absolutely.
And it's a big issue, and I have been an expert witness in a number of lawsuits in which people were treated with tanned skin, and the settings were just wrong.
Right, because when someone has tanned skin, their melanocytes are super activated.
Yeah, hyperactive. Yeah.
And so they may be typically in their chart a skin type 3.
Yeah.
But with tan skin, now all of a sudden they're a 4 or 5.
Yep.
And sometimes a practitioner won't take that into consideration. They treat them as a 3, and then we have residual damage
Yes.
because they were treated at a setting that was way too high for their skin type because they have the tan and the melanocytes are just going crazy. So with Aerolase, you are able to adjust the skin type from a 3 to say a 5 and continue to treat them with tan skin as long as you are able, as long as you adjust that skin type.
Yep.
And the another thing about skin typing is a lot of times people don't take into consideration ethnicity.
Yeah.
They just say, oh, you look like this, so
Oh,
you're
yeah.
a 3 or you're a 2.
Yep.
Well, just a real quick story. When I first started in the industry, I had a front desk girl at our med spa, and she was so fair, blue eyes, fair skin, and I was doing a bikini laser. And she was hyperpigmenting, but her skin was she was looking like a 1. And I didn't really have an official chart on her because she had worked there. And I said, why are you hyperpigmenting? And she was like, I don't know. I said, what's your ethnicity? And she said, my father's African American. And I would not have thought by looking at her ever that
Yeah.
she would hyperpigment. She
Yep.
was so fair.
Yeah.
But she was. So taking that ethnicity into consideration
Yep.
and changing their skin type accordingly
Yeah.
is crucial, and it doesn't happen a lot.
No, and that's one of the things that I teach laser students to ask, because anytime we're judging somebody on a Fitzpatrick skin scale, you're looking at their hair color, their eye color, and their skin color. But then the 2 questions that I always teach them that they have to ask is, what is your ethnic background, which sometimes they're adopted and they don't know. But number 2 is, how do you respond in the sun? Because I bet you, even though she was fair, she could tan. And we would have
Absolutely.
assumed that she would have burned.
She would burn.
And she probably didn't, because she had that darker Fitzpatrick skin type. And it's like, I always tell them, when in doubt, you go one Fitzpatrick skin type higher, because you have no idea where they're at, or especially if they're adopted and they don't
And
know
they
what their
don't know.
ethnic background is, you have to judge them as higher.
Right, because there is potential melanin in the skin
Yep.
that we don't see.
Yep.
And it gets activated by sun,
Yeah.
and a laser could activate
Yep.
it also. So it's so important to really investigate
Yeah.
before you treat. I always say that first treatment is like, that's your chance to
Yeah.
really, do what's right. And then from there, you can get a little bit more aggressive if it's possible. But, test it out. See if they have this background, make sure you have taken it into consideration and treat them accordingly,
Yeah.
because it's
Well,
crucial.
And I want to put up some of those before and afters, because Larry was
Yes.
talking about that, the Fitzpatrick 5 and 6 skin rejuvenation. We've talked about a lot that a lot of times for darker Fitzpatrick skin types, the only options that they had were chemical peels or just plain microneedling. But now this is an option for rejuvenating the overall skin for Fitzpatrick 5 and 6 that they can safely do without the risk of rebound hyperpigmentation, or even worse, hypopigmentation. And look at the
Yes.
clarity of that skin in those
The
photos.
texture, the tone it's amazing.
it's
I actually
beautiful.
did this treatment, so
Oh,
I
good.
can
good.
attest. I can attest to it. But like you said, hypopigmentation
It's even
is
scarier.
a huge concern, because that's really hard to correct.
Mm-hmm.
But that client, her tone and texture and her pigmentation on her face changed so dramatically, and it's there was a time where that wasn't even an option for
Yeah.
someone of that skin type, and what it can do for so many people, it's just it's so exciting to me.
Yeah. Well, and so, here's the Neo Elite. We know that one of the benefits is the fact that we can treat with darker skin types, but it can do a lot of other things.
It does a
so
lot of
I want to
things.
start jumping into those, because acne is another big one, right?
It's
So
huge.
let's talk a little bit about what Neo Elite can do for acne.
So the Neo Elite works so well on acne. I've used it so many times, and have kept young patients especially off of Accutane,
Which is excellent.
which is great, because we would rather not put them on that medication if possible. I talk to them also about the home care. It's
Yes.
a whole picture. It's
Yeah.
not just the treatment, but the Neo works on the the inflammation in the acne.
Yep.
It also works on getting the sebum production to produce properly, not to overproduce. Okay.
Okay.
And by superheating the skin, you're killing the bacteria.
Okay.
So you're working on inflammation, sebum production changing, and the actual bacteria that's causing the acne to spread.
Okay.
So immediately after a treatment, you will actually see the skin just looks calmer, better, less inflamed, less angry.
Yeah.
And then over time, it starts to clear.
Yeah.
Once acne is active, it has to run its course.
Yeah.
It's not like I have a magic wand and I can just say, oh, the pimple can disappear. It still has to run its course
Yeah.
because it's out.
Has to
But
purge,
it
yeah.
shortens that time duration that the acne is going to run its course. And it prevents future breakouts, and it helps to continually keep the skin clear. Oh, I think we have some acne actually.
We do. We have
photos.
some acne and PIH photos. Yeah.
Mhm.
See, check this out.
So this is
a
unbelievable.
huge difference in this patient.
And
I
it's
mean,
not only you can see the acne, but the inflammation, the redness. It's just actually smoothing of the skin where they may have had some scarring. It's going to
Yes.
work on that, because we're also producing collagen by heating
Yes.
up the dermis.
That was exactly going to be my
Mhm.
point, because not only are you killing the active lesions, but you are helping to remodel the skin at the same time,
Yes.
correct?
Well, again, we're starting with a 1064, not a
Yes.
small wavelength.
Yeah.
This is a long wavelength, and the pulse might be short, but there's always three things with darker skin or anything like that, and that's wavelength,
Yeah.
and you look at what's the pulse width, and you look at the power.
Yes.
And so here, if you're starting with a long wavelength, you're somewhat safer to begin with. But now you've got the depth that you need to go where you need to go. And by doing it and shorting your pulse width on it, you're so much safer. You're not overheating.
You're not overheating. Yeah.
So you're able to do many, many things that the others won't do. In fact, I was talking to Dr. Chillicurry about this at the last meeting, and he was on one of our podcasts, and he said, you will love it. So he was very excited that we were getting this system. He said, we're going to love it, and you use it all the time. So anyway, again.
It's just amazing to me. I feel that the Neo, basically the Neo Elite, you could open up a med spa, a dermatologist's office with just that one device.
Yeah.
Because we can treat so many different, conditions.
Yep.
Melasma, rosacea,
Yes.
acne,
Yes.
pigment.
Yeah.
There's just so much scarring. It does
Yeah.
such a great job with
Yeah.
scarring. It just, the list goes on of things that you can treat. So hair removal, you can open up a whole practice with just that one little box.
Yeah. Well, and let's talk about melasma briefly, because then I want to jump into your guys' other device. But I love to talk about melasma because this is such a difficult thing to treat. And
So
this
difficult.
is one of the indications for Neo. We actually have some before and after pictures of a melasma patient as well. But let's talk about how you use this for melasma and some of the success that you've seen with it.
Okay. So melasma has always been a challenge. Melasma
Always.
is different, and people don't always realize this, but it's very different than hyperpigmentation from the sun or sun damage.
Yes.
Because that's caused from an outside source.
Yeah.
Okay. Where melasma is a condition it's caused from inside.
Yep.
Okay. So we can't stop it from happening, but we can control it and calm it down for the client.
Yeah.
We can't completely remove it because it's an active condition. It's happening. But we can settle it down and work on breaking up some of the pigment and working on the hypervascular that's feeding the condition.
Yes.
Okay. And it does a lovely job. It's amazing, how well it works. I'm a firm believer in that melasma does not like heat.
Yes.
It's not a fan of heat.
We are totally a believer in that.
Absolutely.
So I have the most success when I'm doing melasma and I keep the skin nice and cool.
Yep.
So with either a Zimmer or even a small ice pack right after you treat, just so that skin doesn't get too hot, because we don't want to aggravate it.
Yeah.
We just want to, it's like that perfect spot we want to be.
Yep.
But the results we get are just phenomenal. And I don't really know of any other device that you can get results with melasma well. This is one of the only devices I've ever had success really seeing genuine results, that lasted and with a little bit of maintenance when it, for people.
Yeah. And that's where the Neo can give us that broad variety. So you're going after acne, rejuvenation, melasma, rosacea, leg veins. So it's like you were saying, a practice could even hair removal. So there's a lot of different things you can do with the Neo Elite. But that's only one of the tools that you guys have in your toolbox. So I want to talk about your other one called the Era Elite before we run out of time, because this is also
I could talk all day about Aerolase.
I could talk for a long time about the Neo, because that was the one that I was
so
like,
exciting.
yeah, that was the one I raised my hand. I was like, I need to know about this one, because
want
this checks quite a few boxes that, not that I couldn't treat them, but it looked like it could do it better than what I was doing.
It just does it better.
But the Era Elite. So tell me a little bit about what the Era Elite is.
Okay, so the Era Elite is our other device. It's a 2940 erbium YAG.
Okay.
So when a 2940 erbium YAG has one target, as opposed to the 1064 Neo has 3 targets.
Yeah.
This has one target, which is water.
Yep.
Okay. So this device is so highly attracted to water that as soon as the energy gets to the skin, it fully ablates the skin. Okay. When I say fully ablates, I mean it's complete destruction of the epidermis.
Yeah.
Not fractionated destruction, complete destruction.
Okay.
Okay. So it takes off that top epidermis superficial layers. With each pulse, we can get deeper and deeper, but it's about an 11 microns into the skin,
Okay.
which I think we have a photo that can kind of give you an idea of how deep that is.
We do. We have a depth of ablation measurement photo that will kind of give you an idea of where that's falling in there.
There you go. So it's the top one tells you that 1 micron is 1 millionth of a meter. So I can't see where it says about the hair, but anyway.
It's got the little picture of the hair at the
Yes.
bottom, though.
So that's about how deep one pass would be.
Yeah,
So
okay.
you have the ability, though, to do multiple passes, to stack passes. What I like about it is there's no lines of demarcation.
Okay.
So you could do a full face and then go back and treat nasolabial, crow's feet, whatever areas, scarring if there's scarring, whatever area the patient has concern, you can treat. The other great part about this ablation is the downtime is very minimal. It is 3 to 4 day downtime.
Okay.
It's very comfortable social downtime. So you can go to the food store with a hat on. You're not hiding in your house. There's no blood involved. It doesn't go to the dermis, so you won't have any pinpoint bleeding or anything like that. It's really easy and comfortable to recover from. The other amazing thing is it can be done on skin types 4 through 6.
That's what I was going to ask.
Yes.
So you can use this on all skin types,
all
1 through
skin
6.
types, full ablation.
Now, my guess is if we wanted to do pretty deep lip lines, you probably wouldn't go so deep. I mean, you could keep going deeper, pass after pass. But again, if you got to a skin type 4, 5, 6,
We wouldn't, yes.
you wouldn't go there. Okay,
Exactly.
yeah.
So basically what we're offering to a skin type 4 through 6 is the chance to be able to have full ablation of the skin.
Yeah.
As far as going with multiple passes or stacking pulses, that option is really not, for 4 through 6. But the fact that they can do the full ablation and really get that complete destruction of the epidermis is wonderful because it was never able to really be done before. So, and the results we're seeing, we've done, so many studies, and we have had 0 problems, no hypopigmentation, which is my biggest concern.
Yes,
Hyper I
absolutely.
can fix.
Yes.
Hypo, but we have
We
had
feel the
none.
same way. Yeah.
We have had none, so we have the appropriate settings. We have a protocol written up for that 4 through 6. So actually, we're having a big event this weekend to kind of launch it in
good.
Philadelphia. So it's really exciting for the
Good.
company.
That is awesome.
Well, years ago, we had CT3. I brought this up before, and where you're treating color, tone, texture, tightening. So between these two devices, you have CT3. So they call it reverse.
Yes.
So it's just a different name, same type of thing, and it's all coming out of these 2 boxes. And literally like 80% is just, with the Neo.
Yeah.
I mean, you're doing so much with the Neo that you almost have
Yeah.
all the CT3. But if you want to take a little bit of lines off, some wrinkles, some of the hard texture on top, boom, you've got it.
You have the era.
So let's talk about what reverse is and what brought about reverse. So let's get into that a little bit because Larry threw that term out there for us.
Yeah,
so
he
let's
put it out
explain
there.
it
So
to our listeners.
reverse is the name of this treatment. So
Okay.
basically, reverse is our Neo Elite combined with the Era Elite.
Okay.
And the way years ago, CO2 fractional was a
Yep.
huge ablation, the most popular ablation that you would see.
Yes.
Everybody was doing CO2, 10,600 nanometers,
Yep.
and that is ablating the skin while at the same time working on the dermis to cause collagen remodeling, and it happens at the same fire. Well, we were when you think about the Neo Elite and the Era Elite, they're basically doing the same thing. So the Neo Elite is heating up the dermis,
Yep.
causing collagen remodeling, and the Era is ablating the top layer of the skin. It's just in 2 different processes, one after the other, instead of both at the same time.
Okay. Yes.
But we find that it's actually an advantage. Maybe it takes a couple more minutes, but the skin is able to heal faster because it's not such a hard hit.
Yes.
And it does everything you could possibly need to do to your skin. It's working on pigmentation, collagen remodeling, redness in the skin. Then we're also working on tone, texture, tightening. It's such an amazing treatment, and it's a very dramatic result. The client gets that wow factor that they're looking for from reverse. It's very customizable. So obviously a 20-something isn't going to need as many treatments as a 50-something.
Absolutely.
So we have protocols for, say, someone in their 20s could maybe do reverse once and then not do it again for another year or two or 2 years, whatever. But someone who's in their 50s and hasn't done anything, we might need to do 2 or 3 to get them caught up. The nice part is the downtime is minimal, so that they're not shut up in the house if they don't have that luxury to be able to, do something really with a lot of downtime.
Yeah.
So,
And again, we've had podcasts on exosomes, so that whole process is speeding up.
yep.
That if you just take away one whole day, all of a sudden you've got a long weekend and you're done.
And you're done. And I have done so many clients on a Friday after work, and they return to work on Monday with absolutely no concerns. You can't, maybe someone who's like a really close friend would say, why does your skin look a little blotchy? But it's not something that, is people would just notice walking around.
Well, and we have a photo of the mechanism of action of the reverse. So I kind of want to show that.
Oh, that's great.
And then we'll go right into our photos of the results by the reverse. So this is that mechanism of action that's going on with the combination of the Neo, and then we have the Elite, or the Era right after. So we've got Neo Elite, Era Elite, and how these different wavelengths are interacting with the different layers of this skin. Like you said, to achieve the result without it being such a power-packed punch, like doing a fractional CO2.
Right. And I really feel, I actually did this treatment too. So this is just beautiful, I think.
Yes.
She is in her early to mid 40s. She, in the first picture, you can't see how, but she really had some scarring also.
Okay.
And look at how amazing
Yes.
that is
Absolutely
from doing
smooth.
reverse.
Yeah, just her texture overall
Totally.
looks
It's just
significantly
beautiful.
better.
It took about 10 years,
Oh, yeah.
just because I feel that the texture is so important. When you look at somebody, the texture of their skin is, something really grabs your eye, not just the wrinkles. Everyone might have some wrinkles, but if you have a nice smooth texture, it makes your skin look so radiant and just beaueful.
Yeah, here's
The
another
same
one as
thing
well.
here. This is after 4 treatments. So she had some scarring, some hyperpigmentation, some redness, and it really did a nice job clearing all of that up.
Oh, yeah.
Reverse is just, it's phenomenal. Like, this
Oh,
is
yeah.
unbelievable.
I think this is just the Neo Elite.
This is
but
just
still,
from the Neo.
with literally no downtime for this.
Zero downtime.
Yeah.
So you can jump in at lunchtime, jump out, go back to work. Nobody knows you had a laser treatment.
Yeah.
And after 4 to 6 sessions, your skin is looking absolutely amazing. I mean, after 1 session, you start to see it. But when you complete the protocol, your skin really changes. It's unbelievable.
So I just want to go back and revisit one other thing because I know we're almost to the end.
Okay.
But you guys said, we kind of talked about, so we had the Neo Elite, we had the Era Elite, and you guys were using them separately. So what brought about using them together?
Well, I know for myself, when I came to Aerolase, I fell in love with the Era in combination with the Neo. I just was like, we have everything we need right here, So we were very focused on the Neo and kind of getting it off its feet and getting it out there. And now that Aerolase is getting out there, really getting a good name for themselves in the industry, we're getting much, more well known.
Yes.
We're bringing the Era and we're trying to, combine the two for that perfect marriage. That's ultimately the goal. And I myself have been doing it for 10 years, and it's my favorite treatment. I love what it does. It's actually great for anyone. There's nobody who can't do it, which is another thing that makes it amazing, because a lot of times people are limited to what they can and can't do, and this really offers it to everybody.
Oh, yeah, absolutely.
And a lot of practices purchase devices and think they're going to be able to do things with them, and then they can't, and it's too late, so do your homework.
I would also like to make a comment on using the device. So a lot of times when you have a new device and it's like, okay, you got to get your people to go and use the device. They're used to using something else. Well, this was really been pretty easy, just we schedule a couple things, get them using it, and it is so easy.
Easy.
It is so easy to use compared to most things that I've used over the years. it's wonderful. I think this would be ideal for many practices to get started with because anybody in your office can do this.
Yes,
It's not difficult.
The functionality of it is
Yeah.
just unbelievable. There's no calibrating anything. It
Yep.
turns on so easily. It's easy to hold, easy to fire. Our protocol book is so amazing.
It is.
You know, the way
it really is.
It doesn't just give you your settings, but it gives you time between treatments, number of treatments, mechanism of action, who's a good candidate, who isn't a good candidate. All those things are so crucial and important
Oh, yeah.
that a lot of protocol books don't give you that
They don't cover that.
information.
Yeah.
Yeah.
So I love that we offer that to our client, and the device is just phenomenal. It really, truly is, and I'm so excited about it really getting a name for itself. I can't wait till everybody's out there using it.
And for offices that have more than one office, this is a suitcase,
Yes, it's totally
which is
portable.
always shocked. You just open up the suitcase, put it on a cart, and you're good to go. So I mean, it's very impressive that way.
And even from room to room, not just
Yeah.
not just two offices.
Yeah.
It's
Yeah.
really
Yeah.
nice. Sometimes we have to dedicate a room to a certain device because it's so cumbersome.
Yeah.
Where this,
Yeah.
we can just roll right to the next room, and it's easy, to go.
Absolutely. Absolutely.
So the day of a laser being the size of a car,
God, I was thinking of half of the treatment room that,
crazy.
one of our old lasers back about 15 years ago when I was doing it, it was an old tattoo removal laser.
Wait, was
And-
it the one with you literally looked like a superhero?
No, but
Okay.
it was at least, I would say the box, like length and width wise, it was probably 2 feet by 4 feet.
Okay.
I mean, it was a
Enormous.
big box. Now, the height wise, it wasn't super tall. It was low, like a tabletop. But I mean, you're talking an entire coffee table. Like that you
And
had
in
to
the
scoot
small
over.
room.
Yeah. That you had to scoot over to the side because if you moved it too much, it would throw off the mirrors in the arm.
And then you would have to recalibrate everything, and then
or you'd have
start
to
all
hire
over.
no, when the mirrors went off in those arms, you'd
Forget
have
it.
to pay somebody $5,000 to come out and fix
Yep.
it. And it was like nobody was allowed to move that thing. It stayed parked in the corner.
Don't
it
move
took
the
20
tattoo
minutes
machine.
to warm up. Yeah. But literally like 4 feet by 2 feet coffee table parked in the corner.
And that's the other thing about Aerolase. We very, very rarely have service issues.
Oh, yeah.
Because we have people literally hand putting these devices together and checking, rechecking. The service is amazing. We have really great clinical support, marketing support, all around. It's like we're the iPhone.
Yeah.
Everything wants to get smaller. But with lasers, that wasn't happening. But
Yeah.
it's happening. Get them smaller but effective, and
Yes.
as effective as Aerolase is.
Yeah. No, definitely.
well, we've been impressed. We haven't had it that long, but in the time we've had it, it's easy to operate.
Yep.
The results have been very good.
Yes.
Every bit as good as the physicians that told me about it.
Mm-hmm.
And so, yeah, we're happy.
And we're so happy that Clearskin is using Aerolase and going to bring it into your school.
Yep.
I think it will be such a great tool for the students.
Oh, yeah.
Because it is simple to use, so it won't be so complex, so they can absorb the actual science behind it
Yeah.
without worrying so much about doing it.
Yes, absolutely.
Because they get very caught up on doing it when really that's not the most important part. It's
Yeah.
what are you doing?
Yeah, exactly. Kind of important.
Yep, that's right.
Good. Well, I think we're going to kind of wrap up here towards the end. So, as our guest today, do you have any last words of advice for our users?
Well,
Or listeners, I
Thank
should
you so
say.
much for having me, today. I was just saying how impressed I am with the Clearskin Institute. It's like my education dream. I'm a nerd at heart. I'm so intrigued by education and learning more all the time. I feel like everyone always can learn more. You never know everything.
Yep.
And I just love that you guys are about education, and I'm so happy to be here representing Aerolase, and it is such an amazing device, and I'm proud to work for the company.
Good,
Great.
good. All right. Any last tidbits, Larry?
No, I think I've said all I can say today.
I have never heard that phrase come out of his mouth.
I will add that with Aerolase, and again, we do try quite a bit of technology. We've got a lot of technology, and so to bring in more technology is like, really, what are we doing? But like Ann said, and she's bringing her hand up.
I know. I was like
Okay,
slowly
there's-
raising my hand in the meeting.
there are some things, that it fits, it just checks the boxes. And I have a hunch that if it checks the boxes for us, it probably would check the box for you out there. And as far as patients are concerned, it's just one more device that allows everyone to be able to get safely treated, all skin types, get great outcomes, and that's really what the whole business is about.
And the one thing I forgot to mention, it is so comfortable
Oh,
being
yeah.
treated,
Yeah.
which is kind of huge.
Pain free.
Yeah.
It is pain-free. It is
Yeah.
so comfortable. Even the ablative treatment, you do not have to even use numbing cream.
Yeah, very minimal discomfort.
Very
Well,
minimal
I
discomfort.
would have numbing cream.
I know. Some people may want it, but I have done it many times without numbing cream, and I was, it's not like, it doesn't feel good, but it is not painful in any way, shape, or form.
Okay. Yeah, we'll probably
Fabulous.
still use numbing cream.
That's
Larry
okay.
and I are
You
kind
can,
of babies.
but it is a possibility without.
I'll probably be sucking on Pronox just because it's there. It's calling my name.
But either way, it's like you don't need the nerve blocks and the drugs and
No,
like all the
not
stuff
at all.
that you need
A
with
simple,
other things.
yes. Mhm.
Yeah, very easy to do.
Very pain-free.
Excellent.
Good. Good. Well, I think that's going to wrap us up for today. So I just want to say thank you for all of you guys that are joining us, and we'll see you guys next time.